We're going to start with a few words from Yael about the film. Yael Bridge is an Emmy-nominated documentary filmmaker. She produced Left on Purpose, winner of the Audience Award at Doc New York, NYC. She was also the director of productions at Inequality Media, making viral videos that tackled complex political issues and gained over 100 million views in 2016. She holds an MFA in documentary film and video from Stanford University and an MA in media studies from the New School. She resides in Oakland, where she works as a filmmaker and film educator. Over to you, Yael.
Hi, thank you so much. I don't want to talk for too long because we just have an incredible group of panelists to chat. I just wanted to thank you all for coming and participating. This is really, it's been a long time working on this film, and it is really, truly, this was, part of the goal, or not part of the goal, really, a very the goal was to have it come out and be able to be used as an organizing tool around these issues, which are near and dear to mine and all of our hearts. So yeah, this is just really awesome. So thank you so much. I'm really glad that you were able to watch, and that we'll be able to have these conversations now and ongoing. And thank you so much to DSA Fund and Dissent and all the other organizations who helped make this a reality. So I will hand it back over, and I will be back later. Thank you so much.
Thanks so much, Yael, for introducing the big, scary S word. Tonight, the focus of our discussion on issues raised in Yael's film is socialists fighting for universal health care during COVID and beyond. This event is co-sponsored by the Democratic Socialists of America Fund, Dissent Magazine, DSA's Medicare for All Committee, Physicians for a National Health Program, PNHP, DSA's Healthcare Workers Collective, and In These Times. And I'll go through the panelists that we have for tonight's discussion. Susan Rogers, she's the president of Physicians for a National Health Program, recently retired from Stroger Hospital of Cook County, but she continues as a volunteer attending hospitalist and internist there. Prior to retiring, she was co-director of medical student programs for the Department of Medicine and received numerous teaching awards from medical students and residents. She's an assistant professor of medicine at Rush University, where she continues to be an active member of the Committee of Admissions. Michael Lighty has organized, advocated, and developed policy for single-payer Medicare for All nationally and in California for nearly 29 years. He is a founding fellow of the Sanders Institute. Lighty retired from the California Nurses Association, National Nurses United, where he was director of public policy. He was lead policy analyst, a leader of Healthy California, and testified on behalf of the single-payer bill SB 562. Most recently, he was the healthcare constituency director for Bernie 2020. Dennis Kosuth is a registered nurse for over 13 years. He works full-time in public schools and part-time in an emergency room. He is an active member of his unions, Chicago Teachers Union and National Nurses United, as well as the Chicago DSA. Rebecca Wood began as a patient advocate for her daughter, Charlie. This led to the civic participation as a volunteer and later as a team leader with the nonpartisan voter registration organization Headcount. However, her first time on Capitol Hill and her active engagement began in January of 2017, where she stepped up to join the fight to save the Affordable Care Act and Medicaid. Since then, Rebecca has worked with many organizations and offices on Capitol Hill. Most notably, she told her and Charlie's story at the introduction of Senator Sanders' Medicare for All Act of 2017 and testified before the House Ways and Means Committee hearing on pathways to universal health care. And I'm your moderator. My name's Elizabeth Lawlish. I'm a registered nurse in Chicago. I'm also a union steward with National Nurses United, and I'm the co-chair of the Chicago DSA Labor Branch. I'm going to say a little bit about how we're going to run tonight's event. First of all, we'll watch a 3-minute clip from the film, so you'll get a little bit of a teaser. And then the first half of the panel, for about 30 minutes or so, will be a discussion generated by questions I asked the panelists as moderator And in the last half, another 30 or so minutes, the panelists will answer questions that you ask in the Q&A. So please use the Q&A button at the bottom of your screen to ask questions as they come to you during the discussion. The chat box will be closing now so that you can focus on part 1 of the discussion, and it will reopen for part 2 of our discussion. But the Q&A box will be open the whole time, and someone will be keeping track of the questions for part 2. If you're on social media, you can also ask questions there. So let's start with a short clip from the film, The Big Scary S Word.
Healthcare in America must be a right, not a privilege.
The role of government is to help us organize together to get the basic things that we need and to set some standards for how we all agree we want to treat each other. I think healthcare should be in the public sector without question.
Our healthcare system is broken. It's time we look to single-payer healthcare as a way of ensuring that families aren't faced with impossible choices.
When your heart is failing, when you need an appointment, when you have some kind of deadly disease, we shouldn't be worrying about what kind of funding you have or don't have. We should just be worried about your healthcare. In the public sector, there's accountability to the public. And in the private sector, there's not. There's only accountability to whoever is the private owner. There's no obligation to provide all the health care that is needed. It's a predictable thing that people will get sick. The idea of insurance is a good idea. You're preparing ahead of time for risks that you can predict. We can think about having a Medicare for all single payer type system as basically all of us together having one giant insurance policy that's democratically controlled rather than controlled like by people in private industry.
So that is the level of concern and why there are more than 1,000 cases in the United States that have been detected.
56,000 people have died nationwide.
Death toll in the U.S. now officially topping 110,000.
More than 2 million Americans have tested positive for the coronavirus. More than 112,000 of them have died.
Predicting up to 200,000 deaths in the U.S. by Labor Day.
This is a global crisis that we're in, right? This is not a complete surprise. There have been lots of predictions. At some point, we're going to have a pandemic. Gosh, it might be something viral. It might be airborne, like the flu. The COVID-19 pandemic makes really obvious the problems that already exist in our healthcare system. Where I work, we already had a huge problem with not having enough nurses and other healthcare workers. We already had a huge problem of not enough hospital beds, not enough equipment, not enough training. What it shows about our healthcare system is that it's not set up to provide healthcare as its primary goal. It's set up to make money for the healthcare industry. There's so much wealth, so much intelligence and smarts and inventiveness and entrepreneurship and all that in this country, but we can't provide just really basic stuff for ourselves. If we were one person, it's kind of like we can't take care of ourselves. We can't brush our teeth, we can't take a shower. We're not doing some really basic stuff that we need to do to take care of ourselves. And it doesn't sit right with me.
And now for part 1 of the panel discussion. We're anxious to get to as many of your questions as possible. So we have asked the panelists to limit their responses to 3 to 5 minutes each. So I'm going to just take a couple of questions. I should say, put out a couple of questions to the panelists and based on the film clip and other things as well. So the film clip begins with Senator Bernie Sanders saying healthcare in America must be a right and not a privilege. So why is this idea important, and how do we put it into practice? Why don't we begin with Susan?
Okay, thank you so much, Elizabeth, and thank you, Yael, for doing this this clip. I think it's very important, and I hope everybody gets a chance to see that. But as part of Physicians for National Health Program, we believe that healthcare is a right and not a privilege. By being and living in this country, you have a right to healthcare. Now, to be a healthy and a functional country, you have to have healthy and functional people who live here. I mean, that just sort of goes along with it. Unfortunately, though, the system that we have, not just in healthcare, but all the for-profit and capitalistic systems that corporations that we have created an environment and culture of inequity. And what has happened is that inequity has now become normal for a lot of people. It's become part of who we are. We don't even think about it, unfortunately, as not being the right thing to do. We know that we all need health care, regardless of what our job is or how much wealth we may have. And our current profit-driven system of private health insurance is clearly not working to do that. Now, whether insurance is from your employer, whether you buy it on the exchange, whether it's privatized Medicaid or Medicare Advantage, a system based on private health insurance, which is there just to make profit. It is not there to provide health care. It is there to make money. Those are two different things that often do not work well together. It is costly, and like I said, it is created to make money. And this system not only leaves millions of people uninsured and underinsured, it creates financial disaster for many, inadequate treatment of many medical problems that are easily addressed. It creates early and unnecessary deaths and needless suffering. Now, let's be clear that just having insurance does not guarantee access to care. People have out-of-pocket expenses, deductibles that they can't afford to pay. So what happens, especially with private health insurance through your job, you end up paying for this every month, but you can't pay down your deductible to access the care. So I look at the insurance card as really a donor card to Blue Cross Blue Shield or a donor card to Cigna, because you can't use it. It's not worth anything to you until you pay thousands more dollars to access that care. It's almost as if somebody gave you a brand new luxury car that you've always wanted, but they didn't give you the key. So the car sits in front of your house, totally worthless because you have no key. And if you can't pay your deductible, you have no key to your insurance. So what we need is a government-run, privately delivered, single-payer system where the government pays for it all. It's privately delivered by providers in their own environment, not in government buildings. And that's what we need to fix this. So let's be clear about what is right here, who has the right. We have a right to health care. Profit-driven health insurance does not have a right to deny you care to make money.
Thank you, Susan.
Am I under time? So
you are.
Okay.
Thank you, though. Very powerful. Rebecca, do you want to go next?
Sure. I think the idea of healthcare as a right is so important because nobody should die because they can't afford healthcare. Getting healthcare shouldn't cost people everything. And people shouldn't be maimed because they can't afford to treat their ailments. And it's absurd that that is how things are in our country and that is the way it works. As far as what we can do about it, I think we fight like hell for Medicare for all. It's a wonderful bill. It not only gives us access to healthcare with no copays or deductibles. It also has dental and vision included, which current healthcare policies don't have. And as far as our country's healthcare system is concerned, I feel that is the way to recognize healthcare as a human right and for everybody to have access to it. Anything short of it is just giving to insurance companies.
Thank you, Rebecca. Michael?
Thank you, Elizabeth, and thank you, Yael, for just an incredible film. And I really appreciate the DSA fund, and shout out to my DSA comrades in the Medicare for All committee. We basically start from the premise, as Senator Sanders does, that the current system, as Rebecca and Dr. Rogers have said, is one where you get all the health care you can afford. And if you can't afford it, you don't get health care. And that, of course, is unique. There's no other country of a comparable economy that has this kind of system. And even those countries that might have some form of what we would call private insurance do not make the kind of decisions and are not for-profit entities like the American insurance companies are. And so in this unique situation, healthcare is a privilege. And we have an ideological fight in our hands because there are certain people who believe, well, you got to work hard. And if you don't work hard and you don't provide for yourself, well, you don't get healthcare. That's just the way it is. And we hear that a lot. And I think as socialists, we have to confront that directly. And it's something Senator Sanders says in the film as well. In fact, I think it's his closing statement. The real problem is we have to raise our expectations. And workers in this country often, because of the oppression and just the need to survive in an economy where wages are stagnated, healthcare is unaffordable, and you're basically under siege, either because of systemic racism or the power of corporations, it's easy for people to just give up, to say, yeah, we don't deserve it. And so I think we have to do that. I think we have to say healthcare is a right because we deserve it. And what we're talking about, we're not talking about universal coverage, as Dr. Rogers said, where you get insurance that you can't use. We're talking about guaranteed healthcare for all with no financial barriers to care, regardless of immigration status, that provides culturally competent care that addresses the history of systemic racism and creates real health equity. This is ultimately a campaign for healthcare justice. And I think that phrase, healthcare is a right, not a privilege, embodies that demand for health justice and for guaranteed health care for all, and to catch us up with other comparable countries, and to put a unique, ultimately American approach on it. That's why we often talk about improved and expanded Medicare. That's an American program. Call it socialism. Fine, it is. We're socializing a big sector of the economy because that's the only way to meet human needs and to make it a public good. And I think that's really the ultimate objective for a healthcare system, as John Pearson says in the film.
Thank you, Michael. And finally, Dennis?
Yeah, I really want to thank Yael for amazing film, amazing work. People should watch it if they haven't seen it already. Share it with their friends, get the word out there about it. Thank you for the DSA Fund for this opportunity to have this conversation. I really appreciate the comments from the other panelists. I'll just focus on one thing. There's a sign that my union made called "Racism is a Public Health Crisis," and I think that's a serious thing that we have to talk about when it comes to a healthcare system for all. I just want to tell briefly a story about something that happened in Chicago recently regarding vaccinations. There's this hospital located on the west side of Chicago called Loretto Hospital, and the CEO of that hospital, George Miller, decided to use the vaccinations that were given to that hospital on the west side, which is a predominantly African-American neighborhood, and give it to his friends at his church. The COO, the chief operating officer, who owns a condo in Trump Tower, who has a picture with his arm around Eric Trump and talks about how he has buddies in high places, also gave vaccines out that should have gone to the residents of the west side of Chicago, but to his friends who own a steakhouse on the Gold Coast where steaks go for $180. He gave other vaccines to friends who work at luxury watches. I think this really underlines the disparities that exist in how capitalism and a profit system rewards people like Dr. Ahmed, like George Miller, the CEOs, to do disgusting things like this and let them get away with it. We already know about the outrageous gap that exists in health when it comes to racism. African-American men are 40% more likely to die from colon cancer than their white counterparts. African-American women are 3 to 4 times as likely to die during childbirth as their white counterparts. African-American babies are twice as likely to die during following delivery compared to white counterparts. And these are all numbers that existed before coronavirus. You look at how coronavirus has disproportionately affected these populations. In Chicago, 70% of all deaths from coronavirus are African-American people, who only make up about 30% of the population. It's a complete outrage that this is happening in this city. There's not a melanin-linked gene which makes you more likely to die from coronavirus. It's because of racism that this is happening in our society. Chicago is home to one of the greatest gaps when it comes to life expectancy. People should read an excellent book by Dr. David Ansel called The Death Gap, when he goes through that methodically about the origins of that gap. In the Gold Coast, where this steakhouse and this luxury watch shop that Dr. Ahmed would frequent, the average life expectancy there is 90 years old. That's not bad, 90 years old. Down in just 8 miles south of there in Englewood, a predominantly poor neighborhood, predominantly African-American, it's only 60 years old. In the third largest city, in the richest country in the history of humanity, there is a 30-year life gap between those two same parts of the same city. That's a complete outrage. It should have been a 3-alarm fire decades ago, but the fact that this goes ignored is an outrage. Racism means that for-profit healthcare for people of color and undocumented means it's even worse for them. And that's why we have to fight for a whole new system, as well as call out the racist aspects of the system as it exists.
Thank you, Dennis. I'm going to move on to the next question for the panelists. Rebecca, who is with us tonight, is shown testifying at a hearing on Medicare for All about how our healthcare system is broken, leaving families with impossible choices. Let's start with Rebecca summarizing her point, and then you all can expand on the issue of what is wrong with the current healthcare system in the US, such that it forces these impossible choices on families. Why don't you start, Rebecca?
Thank you. For those who don't know my story, my daughter, Charlie, was born at 26 weeks gestation. She weighed 1 pound, 12 ounces, and she was in the NICU for 3 months. Once she came home, we thought it was over, but it was only the end of the beginning because when she got home, she needed, I think she had 8 specialists, 3 therapists, and she needed therapeutic equipment. She needed special utensils to eat, special bottles, specialty formula. Eventually, she needed a G-tube. She was in diapers years longer than most kids. And she had all of these needs. And the copays, deductibles, and exclusions and automatic denials broke us. My husband was employed and had his insurance covered her. And if in the insurance industry worked, it shouldn't have been that way. Well, eventually we ended up burning through our savings because we were saving up to own a home. And I was having to make choices between my healthcare and hers. At first, it was a small choice. Well, not really small, but in comparison, I had to choose between my asthma medication and her care. And then later on, I ended up cracking a tooth and I needed a root canal and a crown. I put off the procedure 1 pay period because I decided to pay one of her bills. I ended up getting an infection that spread through my entire mouth and jaw. The swelling cut off my airway, and I had to go to the ER to get IV antibiotics. And after I was discharged the next day, I went to the dentist and had all of my teeth pulled, parts of my jaw scraped away, and the infection drained in a 6-hour procedure under local anesthesia because that is what I could afford. And I'm sorry telling that I lost what is wrong with the healthcare system, if that doesn't tell you what's wrong with the healthcare system. But when I testified in front of Congress, I was only given 5 minutes. So that is the part of the story I could tell. But the part I didn't get to talk about was we were affected by geographic inequities. When my daughter was born, we lived in Northern Virginia, but as we ran out of money, we moved further out because it was cheaper. And we sacrificed our access to healthcare because the early intervention in Northern Virginia had everything under the sun. But once we moved out, there was one therapist covering 5 counties, which meant I had to bend over backwards to get her care. And then the automatic denials were awful because I had to contest them. And with her formula was one of them. She needed a specialty formula. And when I contested it, they told me it wasn't covered. I had to read them the part of the policy that provided coverage. And they said, oh, well, I guess it is covered. We need a letter of medical necessity. Her doctor had to supply 3. The first 2 they denied. The third one, he wrote a 2-page letter and sent all of her medical records. And if you know a micro-preemie, that was a lot of medical records, and they finally covered it. But it took 3 months, and her formula cost $27 a day. And I couldn't just not feed her. So that came out of pocket, and we were never reimbursed. I mean, I could go on forever about how many things we ran into that are so very wrong and so unjust. And it's time that we fight this and tear down the system and get everybody the health care they need. Thank you.
Thank you, Rebecca. It's incredible, your story, and extremely powerful. Why don't we next, Michael, why don't you go ahead and build on that?
Whenever I hear that story, Rebecca, my God. And then to think that Medicare doesn't cover dental, right? So that's one of the improvements we're making in Medicare for All is including that. Can you remind me of the question, Elizabeth? I got very caught up in Rebecca's story.
Sure, just a second. So Rebecca testified at the hearing on Medicare for All in front of Congress about how our healthcare system is broken, leaving families with impossible choices. So we started with Rebecca summarizing her point, and then can you expand on the issue of what is wrong with the current healthcare system such that it forces these impossible choices on families?
Right. Well, it's essentially, I think we know, because it is an industry that's designed to make profit and not provide healthcare, that that's the biggest problem. And so what you have is but fundamentally, diving down one level, the insurance companies can charge whatever they want. The hospitals can charge whatever they want. The drug companies can charge whatever they want. So you're in a situation where they said, let's have a market in healthcare. But the market is completely dysfunctional because we have no way of really knowing what we're going to need or how much it's going to cost. And in fact, the market is a fallacy. And the notion that we're somehow consumers of affordable healthcare as a product is a fallacy, because what it really is, it's an essential aspect of humanness. And it's been turned into a market commodity that we consume according to the rules of the profit-making industry. So what we have to call out is we have to make the healthcare industry as toxic politically as the tobacco industry became, because they are killers. It is a murderous, care-denying, profit-making industry that is literally killing people. The Lancet report that I had the honor of being on the commission with was led by PNHP doctors Himmelstein and Wilthandler, pointed out that if you compare the US to other comparable countries, before COVID, they attributed 436,000 deaths each year to the lack of a national healthcare system. So it is literally a murderous industry that, because of its business model, is killing us. And just thank God some of us can navigate it, but who can navigate an EpiPen that costs $600 a month? Who can navigate insulin that if you lose your insurance, as Alex Smith did, and you've died a month later because your rationing of insulin didn't keep you it didn't keep your diabetes in check. So this is the industry that we're talking about, and I think that we're going to have to get to a point of much more militant action. Our stories are profound, but they are not moving even enough Democrats in the House of Representatives. They have got to pay a political price for fronting for the insurance industry and for the healthcare industry and for the deaths and denials that really belong on their doorstep, because they're the ones perpetrating the system.
Thank you, Michael. Dennis, why don't you go next?
Yeah, no, I worked actually for a number of years at an emergency room hospital, the same place Elizabeth works presently, which is a public hospital. It serves poor people. It serves the uninsured, undocumented, people who really have no place else to get healthcare. And it provides excellent healthcare. Susan Rogers worked there as well, as she mentioned earlier. And all the time in the ER, I would come across people who would choose between medication and rent, who would cut pills in half. They would take their blood pressure pills every other day. They would share insulin amongst family members because they couldn't afford the medication. It is a complete outrage. I had patients who they had worked in hospitals. I had a guy who was a security guard in a hospital who didn't have health care. Make that make sense. It was outrageous. I had a patient who, this is right before I was laid off from this one job, and I can tell that story later, who worked full time. He had insurance, he had diabetes, lost his health insurance when he lost his job, and was, he was like 38, 39 years old, thought I could just go out for my insulin. I think I'm gonna be okay. He went months and months and months. He got so sick. His blood was acidotic. Had to go to the ICU. I mean, these are the things that are happening with people on a daily basis. And we have to ask ourselves this question, like, why is this happening? Like we were talking earlier about how racism affects healthcare, and people of color live less long than other people. Why is this happening? Why are people of color dying disproportionately from coronavirus? I mean, part of this has to do with who are essential workers, who's riding the bus to work every day, who lives in multi-generational houses, who has less access to healthcare, who has underlying conditions, and why do some people have these underlying conditions? Is there some gene that's linked to the skin tone that makes you more likely to have diabetes? Absolutely not. It's completely not unlinked to that. These are diseases of poverty, high blood pressure, diabetes, asthma. It comes about to, does the community you live in have clean air? Do you have a grocery store in your house that sells anything besides Arizona iced tea and Takis? Do you have access to a life that doesn't have stress because there's an inordinate amount of violence in your neighborhood, whether from the police or otherwise? Those things cause people to have health issues. So our society writ large is completely broken when it comes to meeting people's health needs in general. It puts profit over every aspect of our lives. A year ago today, I was looking at how, Facebook will say what happened a year ago. A year ago today, I had a picture of me protesting outside of Providence, which is a hospital on the South Side, a public hospital. It's part of the Cook County system. They shut it down for a month because they said, well, we had somebody test positive. I mean, which hospital during COVID didn't have somebody working there test positive, but none of them shut down? It was ridiculous. So they were shutting down a hospital in a Black neighborhood during a pandemic where they were dying disproportionately. And we had to go outside and protest that for weeks before we got them to reopen it before they had originally planned. So it's just outstanding how again and again our society fails us. And we have to stand up and fight for what's right.
Thank you, Dennis. And finally, Susan. You're
Dr.
not.
Rogers,
You're still muted, Dr. Rogers.
I'm sorry. This country has blinders on, and it does not see what it does not want to see. And one of the arguments you often hear about why we shouldn't have Medicare for all or single payer is we don't want the government involved. We don't think the government should have anything to do with this. But if we look back at the history of this country, all the benefits that have mostly gone to the white residents of this country have been given to them by the government. And it started with the end of the Civil War. The Southern plantation owners, they lost their free slave labor. So what did they do? They started putting Black men in jail because they were walking down the sidewalk. And then they started convict leasing. So then they got free labor again. If we look at what has supported this country, the Social Security from the New Deal, all of that, it didn't help Black workers though, because farmers and domestics could not receive that. All the mortgaging of homes so that people could buy homes. However, Blacks did not have access to that. That's what built the white middle class. The developers got money from the government to build that. You know, there's talk about reparations. Who got reparations? The plantation owners. They got $300 per slave at the end of slavery. They got reparations. The slaves got nothing. So people are denying the benefits that they've gotten from the government. Black people are quite clear about what they did not get and what we still do not get, believe me. But the whole idea that the government shouldn't be involved in trying to help things get better is a blindness to the history of what has been done in this country. And I think that we have to be very diligent stewards of a Medicare for all system so that it does remain equitable and that it is Medicare for all, not just for white all. Because if that's the history of the way this country has done things, we have to be very diligent in being the overseers of this system so that it is done fairly and that the poor communities now who are missing hospitals don't continue to be missing hospitals and other resources to provide health care. So this whole myth that getting the government involved is something bad, I mean, people need to look back at the history and see that that is definitely not true.
Thank you, Dr. Rogers. I think we have time for one more question that I'll be asking the panelists before we move on to the Q&A questions, and there are quite a few. So I'm ask this last question. In the clip, emergency room nurse John Pearson talks about the role of government in providing healthcare and why healthcare needs to be in the public sector where it can be democratically controlled rather than the private sector where it's controlled by profit-seeking corporations. We see a clip of DSA members tabling for Medicare for all. What exactly should democratic socialists be demanding of our government? Why don't you start, Michael?
I think number one, we have to use as a touchstone the fact that hundreds of thousands of workers' lives have been sacrificed for capitalism. That the deaths of essential workers during COVID are a direct result of being ordered to work under unsafe conditions. And Public Citizen estimates that in a recent report, at least 70,000, maybe more. We have to understand that this is, they're saying the quiet part out loud when it comes to Texas. The lieutenant governor is saying, yes, workers, particularly older folks need to sacrifice for the economy. Governor Abbott says we've got to open up to sacrifice. We can't have the economy hurt anymore, so you're going to have to go back to work. And this is the ultimate exploitation of labor. And it is not an accident. And again, as Yael's film shows, there's a long history of workers being fundamentally exploited. 35,000 workers died annually in an early part of industrialization, as the film shows. So what socialists have to demand is, first of all, health justice by memorializing, raising up those lives that have been sacrificed for some inhumane and unjust notion of the economy, and to say never again. And secondly, we have to, and this is a multiracial working class, as Dennis has said. When the Labor Institute in New York looked at the impact of COVID in neighborhoods, they found that you could correlate income to COVID rates of infection. Those workers, of course, are primarily workers of color, maybe almost entirely workers of color in huge parts of New York. The correlation to essential work, racism, lack of protection, lack of healthcare is clear. 2/3 of Americans have 2 or more chronic conditions by age of 65. That's what guaranteed healthcare will address. And as Dr. Rogers says, we have to name it. We have to name the systemic racism. So socialists need to demand a multiracial working class recognition of that as the key agent of change. As I mentioned earlier, we have to toxify the healthcare industry, and we have to go beyond just a congressional strategy. We've got to build a mass movement to save lives. This is what it is. We have to save workers' lives by guaranteeing healthcare to all. We need to build a campaign for health justice, even beyond the single payer movement that we have now, with essential workers and the multiracial working class in the lead of that movement, going beyond whatever Congress says is possible, but demanding what we need and what is right.
Thank you, Michael. Next, why don't you go, Dennis?
I think that's a really great question. What we should be demanding of our government. I mean, I think in short, we want the needs of the people to be met, not what the corporations have been doing. Maybe this is a different conversation about whether our government is structured as it's structured is even possible to do that, considering how much money is needed to run for Congress. I mean, you have to literally raise tens of thousands of dollars every week if you're going to run for even a congressional seat, and you don't get that kind of money collecting quarters at the Belmont stop on the red line in Chicago. You get that kind of money by going down to Blue Cross Blue Shield and saying, how much will I sell you for me so that you can get me into Congress and I'm gonna do whatever you want. That's how Washington works. Let's look back at the Affordable Care Act. Max Baucus, who was the chair of the committee which oversaw it, was one of the biggest recipients of money from the health insurance industry. And oh, guess what? This law is going to require everyone to buy this crap product. Go figure how this stuff works. We already know how it works. So we should be demanding everything. We want proper health care. We want education. We want communities fit to live in. We want an end to the pollution that occurs in this society writ large. And how they're going to pay for it? We're going to tax the rich. I mean, it is outrageous to me how much money is spent on the military. We can send, not we, but this government can send an airplane to fly from Arkansas to Afghanistan and be home in time for dinner and drop bombs and kill people. And there's always money for that. There's always money for that, but there's never money to actually meet people's needs. And that to me is a complete outrage. One other point I want to make is these vaccines that have come out in a matter of months show me the possibility, if we mobilize resources in this society, what we can accomplish. So don't tell me that we can't get to the bottom of the racist health disparities that have plagued this country for decades. Don't tell me that we can't get to the bottom of what causes climate change and how to fix it. We know if they took billions of dollars, just like they did for vaccines, if they took billions of dollars of resources and put them towards solving these problems, we know they could. It takes political will to do that, and we have to force the politicians or change how our system is operated in the first place if they're not willing to do it.
Thank you very much, Dennis. Susan, you want to go next?
Yeah, thank you. I agree 100% with what you said, Dennis, and it is these inequities here that have to be acknowledged before you can start trying to fix things. If you look at what happened with the CARES Act and the Paycheck Protection Act and all of that, it didn't take into consideration what was missing in a lot of the communities in this country. How can you get a Paycheck Protection Act if you don't have access to a bank? And so this country did not acknowledge that not all communities have an ATM from Chase or have access to, they have payday loans and currency exchanges, but they don't have a bank. So they couldn't access, and that was done purposely. I mean, people are purposely creating help knowing that everybody can't benefit from the help. And that's what I'm talking about, how we have to be very diligent in overseeing this. If we look at the testing, you know, how do you have drive-through testings for communities where most people don't have a car? It makes no sense. You're not addressing the problem if that's your solution. And I think we have to be very specific. Different communities will need different things because of segregation that was created, condoned, and made legal. We have built, not we, but communities have been built in this country that do not have the structures to support them. And so they're missing a lot of things that the rest of the country takes for granted, and we can't do that. One of the things in terms of providing healthcare, a hospital is often a community center because it's a source of employment. It's a source of medical care. It brings other businesses in because there's people there working who still need to get lunch and they need to buy gas and groceries and whatever. So it has domino effect on how it benefits communities. And so we should address this, not just focusing only on healthcare, but all the other inequities that exist with the inequities in healthcare, because just providing healthcare won't fix all of healthcare needs if all these other gaps in life are still present. So it has to be consistent, and it has to have to look at the big picture in areas that these inequities are, so that we can fix all of them together. Otherwise, being healthy today while you're also homeless, hungry, and cold will not ensure your health tomorrow, no matter how great the hospital is in your community. And that's what we have to address.
Thank you, Doctor. And finally, Rebecca.
I agree with Michael that we should make the healthcare industry as toxic as the tobacco industry is. Our representatives, whether it's on the state or national level, should be ashamed if they're taking healthcare money. I remember when I was testifying in front of the Ways and Means Committee, as I was reading my testimony, I was hit with anger, which was unusual because when I spoke at the Bernie Sanders bill introduction, I was very sad and very upset. But then when I testified, I was surprised. I was very angry, and I wanted to scream at all of those congressmen sitting in front of me. How dare you? How could you let this happen to me? It is your failure that I'm here right now. Nobody should know who I am. I should be home and some soccer mom, not up here in front of Congress. But of course, I couldn't. But what we should demand from government is that our representatives sign on to the Medicare for All bills, whether it's the House bill or the Senate bill, and not just on the national level. There are a lot of states with state bills. I know Massachusetts, New York, Washington, and California are just a few of them. Get to know your state representatives, pressure them to sign on. We should demand this. Anybody fighting for anything less than Medicare for All is okay with what happened to me, is okay with the gentleman who died because he was rationing insulin, is okay with people sacrificing their livelihoods, their health, and their lives because they can't afford health care. And what they consider affordable to them is not affordable to me. And so we just need to get this done and demand it and push for it. I think that more than anything is what we should demand.
Thank you, Rebecca. Now, thank you for all your incredible, powerful, compelling, and thoughtful comments. We're going to be moving into the second part of our discussion, and we're going to turn to the chat box back on in case anybody has any technical or logistical questions. And we're going to focus on questions our friends and comrades have put in the Q&A. It's not too late to add more questions in the Q&A at the bottom of your screen or in whichever social media you're using. Please let us know what you're interested in hearing more about. I do have a growing list of questions, and I'm going through them. And Yael Bridge is going to join us again for this portion for any questions you may have for her as the filmmaker. And before we get to the questions, I just want to again say this event series will be focusing on themes and issues raised in Yael's film, is Socialists Fighting for Universal Healthcare During COVID and Beyond. Tonight's event is co-sponsored by the Democratic Socialists of America Fund, Dissent Magazine, DSA's Medicare for All Committee, Physicians for a National Health Program, PNHP, DSA's Healthcare Workers Collective, and In These Times. So I'm going to start with one question, and why don't we, and then I will call on the panelists as we go through them. The first question I have is, how do we fund healthcare for all? And how much would the US save if it offered universal healthcare? Do we want to start with, I'm just going to go down my screen, give Rebecca a little break. Michael, do you want to go?
Sure. The recent estimates for savings, just in eliminating all the bureaucracy and administrative crap and the pre-authorizations and the care denials that Rebecca and others have described, could save between 450 and 650 billion a year in the US. That's a huge amount of savings. There's also the fact that, without getting into a debate over monetary theory, some people believe you can just fund it out of existing expenditures. There's a proposal for a wealth tax and a corporate tax. The negotiation of prescription drug prices, which Senator Sanders is considering putting in a reconciliation bill, could fund an expansion of Medicare. So and then a tax on the wealthy in particular, who really are not obviously paying their fair share. And in fact, given all the subsidies that they get, many folks in the upper income level do not have net costs for healthcare, according to an Amherst study of a couple of years ago. So it's relatively straightforward to pay for it. Others, we've talked about cutting the military budget. Absolutely. What we've learned, as Dennis says, if you need $1 trillion for a vaccine and COVID relief program, it's there, and we need it. We need it for healthcare. It's there. The question I always ask, people say, "Oh, how can we afford Medicare for all? How can we not afford it?" Is really the issue.
Dennis, do you want to? Or anyone else want to go?
From a personal perspective, something that I've noticed often gets left out when we talk about cost is my healthcare bills each month are astronomical, and it bleeds into other aspects of my life. I'm in a food insecure household because of my medical costs, and therefore I'm having to apply for not WIC, but SNAP and other things like that. And I wonder how many other people out there are struggling with things like that, and how much is it truly costing the government when it bleeds into other sectors that the government is having to pick up.
Thank you, Rebecca. Dennis or Susan?
Yeah, I'll make a couple comments about this. One of the large costs of our current system goes to administration, and it's an unnecessary aspect because that provides no care. We're spending all of this money paying people to decide if you're covered for this, let me deny this, let me see, or whatever. That isn't providing any care. And the other thing is that the way we currently pay for healthcare through our employer is really a regressive way to pay that. If you look at a family plan that's about now, a family plan is about over $22,000 a year. That's what that costs. Your employer pays part of it, and then you are left for the balance, which can be $5,000 or $6,000 a year. You don't see that money because it comes out of your check. But that's $5,000 of money that is yours that you could have had if it was not going to a private insurance. Now, in addition to that, you also have a deductible. So you could be paying $10,000 a year for health care. Now, one of the things too is about that $5,000 that gets deducted from your check is that gets deducted from everybody who works there who has a family plan. And it's not dependent on your salary. So whether you make $30,000 or $330,000, you get that same amount deducted. So it's a very regressive tax because everybody is paying the same absolute dollars. If we substituted that money that is going to the private insurance company by a deduction and instead had a small tax that was based on your income. Number one, that would be more fair. Number two, it would certainly be less than what is deducted from your check now. Plus, you would not be paying all the other out-of-pocket expenses that come. And because we don't have all this overhead, the savings would cover any additional costs. Now, a Medicare for All plan will cost more because more people will, there will be more demand because there will be more people who will be seeking care. But it will cost us less. Doctors can actually see more patients because they will be not spending as much time talking and fighting with insurance companies to get things covered. So the savings are there. The Congressional Budget Office just looked at this, at Jayapal's bill, and said, we can pay for this and we will save money. So it's been proven that this is doable. It's not even a question of, it's shown how we can do that. It is the question of, will we do it? Because there is a way to do it, and that's been proven. We can pay for this.
Thank you, Susan. Dennis, do you have any?
Just real short. I mean, I think it's just as simple as this: is we in this country spend more per capita than anywhere else in the world on healthcare. We spend more, heads and shoulders above any other country when it comes to healthcare, and we have some of the worst outcomes. We're paying more and we're getting less. It doesn't make any sense unless you're Blue Cross Blue Shield, unless you're Pfizer, unless you're a big corporation. It doesn't make any sense. These big tall glass buildings you see in downtown Chicago, they were built off of making money off of people being sick. And so that's my elevator answer when someone asks, you know, I ride an elevator for 30 seconds, why do I think we need a different kind of system? As a socialist, though, I also say, how much money do you want to put on the value of someone that you care about? Think about the person you care about most on this planet, your parents, a partner, a child. Put a dollar amount on their life. How much are they worth to you? There is no dollar amount. In a sane society, healthcare would be a right and everybody would have access to it, even if it was more expensive. There's ways that we could cut the spending that we do right now. But just think about it from that standpoint, from a human rights standpoint, it shouldn't matter how much it costs to make people healthy. But that should be a number one priority of any sane society, any society that's worth itself in terms of taking care of people.
Let me just add another comment too about the pharmaceutical industry, is that what we pay for drugs is phenomenal because they can charge whatever they want and we have to pay it. Now, the VA was able to negotiate with pharmaceutical companies and get lower prices. And one of the advantages that the VA has is they have a national formulary. So whether you go to a VA on the East Coast or the West Coast, it's the same formulary in each VA. And that's another way to limit their cost. But if Medicare had paid the rates that the VA paid, it would have saved over $70 billion over the last 6 years. 70 billion. So there's a way, a fair and sane way to do this. It's just not being done.
I think Medicare for All would reverse Dennis's formula. We will pay less and get more.
Yes.
Absolutely. Why don't we move on to, I've got another question. What developed country health system do the panelists think is the best model for America? If there is one, would it help the cause if that model were loudly proclaimed as the objective?
Well, I would say Canada, their single payer plan is very close to what PNHP supports and advocates for. It is a government run but privately delivered, and it provides universal care to everyone. If you look at other European countries, some of them still are hybrids, some will still have plans like the UK where it's government delivered, and a lot of the physicians and institutions are government owned, which is not what we advocate for. So that would be the closest system to what we advocate for is what's in Canada. And if you talk to people who live in Canada, they love it. They do it. Every system is going to have some issues. There's nothing perfect about anything in life, period. And there are some issues still there. But for emergency care, for care that is needed, you will get it. Because here, you don't get it if you can't afford it. You will get it in Canada.
Is there anyone else? Michael or Rebecca or Dennis?
Just
Go ahead.
quickly, I mean, I think ultimately, from DSA's perspective, we do need something like the National Health Service in the UK. And prior to COVID, though they've done a very good job on the vaccinations, they had real problems because, like some of the other European health systems, they were subject to the austerity that was imposed on European countries during the financial crisis. And austerity kills, just like our healthcare system kills. And so you have to reverse austerity, but the NHS provides a model for real public accountability, a publicly and democratically run system. And in fact, the NHS under the UK was for really quite a long time in the Commonwealth comparative studies shown to be the system that had the best outcomes and the greatest equity. And that combination of good outcomes and equity, I think, should be, obviously the goal of any healthcare system. And it appears that that system achieved it better than other hybrid systems and so forth. I would agree with Dr. Rogers that Canada provides the near-term example for the kind of system that we propose with the Medicare for All Act.
Anyone else? Dennis?
I would just add to that I mean, obviously most other countries have a better system than ours, so it's almost like anywhere but here. I mean, you can even look 90 miles from the shore of Florida. You have in Cuba, people have a healthcare system, and they train many more doctors than they need. I mean, and this is a country that has factors less resources than this country is. So if a poor country, relatively speaking, when it comes to wealth, like Cuba can do it, why can't this country do it? It makes absolutely no sense. And I think to Michael's point, it's also important to raise that across the board, even in Canada and in the UK, there have been attacks on public health systems, because we should remember we still live in a global capitalist system. All these countries are under pressure from global capital to have a race to the bottom to save as much money as they can off the backs of regular people. And so we need to fight for a healthcare system here. We need to fight for a better healthcare system in other countries. I think we also have to fight for a socialist society across all borders. We need a socialist society all around the world that is about meeting the needs of people, not about meeting the needs of corporations.
Rebecca, any thoughts, or we can move on to the next question?
No, they've covered it all.
Okay. All right. This next question, how can incumbent healthcare providers, I'm sorry, just let me, hold on. Sorry, I'm in the wrong, I said, private insurers pools compete for the healthiest patients, just drive up prices. What's the best way to make people understand that private health insurers provide nothing?
Obviously, we're still working on that one. That's a hard question. I mean, I think culturally, this country isn't ready to say that everybody deserves it. They're still on this, individualism thing that you have to earn something before they get it. But one of the arguments that I have used with people who are resistant, thinking that they will get less if we provide it to everybody. And that's that zero sum mentality, is that if I have something and you want it too, that means I'm going to get less. And I like to use an example saying, well, you're talking about a pie that has a certain number of slices, but I'm talking about a much bigger pie. And if the pie is bigger, there's room for everybody to get a slice so that nobody's taking anything from you. You will still get what you need, and so will the next person. So it's not either or them versus me. And I think if people can see that picture and understand that they will get everything that is medically necessary, like they would with the so-called Cadillac health plan, they will be fine, and so will everyone else.
To me, it always goes back to the incredible inequities that exist in our society writ large. And people, I'm sure, have already seen how during this pandemic, when there's all this suffering economically, physically, psychologically, all this suffering is happening. People are losing their jobs, not able to put food on the table, not able to pay rent. Billionaires have gotten even richer. People like Jeff Bezos have added so much to their wealth in a time of so much suffering. It's unconscionable. So you have a few people having as much wealth as 80, 70, 90% of the population, depending on how many billionaires you want to put on one side of the scale versus the, hundreds of millions on the other side. It's completely outrageous. So to me, to say that that we don't have enough resources in our society is not true. To say that there's not enough to go around is just simply not true. The amount of wealth that is created by people who work in our society should be put towards the benefit of the people who do that work. And that's what I think socialism should be about. Working people, running society for our own purposes. And healthcare is going to be a big part of that picture. That's why in the interim, until we get to that social society, we have to fight to have that big chunk of wealth that's going to the profits of the few towards the health of the many.
Something I tell people is that when Charlie was born, I thought I had good insurance, and I never thought any of what happened to me could happen to me. When I was pregnant with Charlie and they said I had preeclampsia, I didn't believe them. I thought it was a mistake. I said it doesn't happen to people like me who get prenatal care and stuff. And I was in so much denial. And I think people need to realize and understand it just takes one illness for everything to fall apart. And once you drive that home, then the gears in the head start turning and they start realizing that they're not as protected as they think they are.
See, I think that's exactly key. How do you convince people about the problems with private insurance? Have them get a serious health condition and try to use their insurance. And that generally converts everyone. And of course, our system is set up so, thankfully, not our system, but just humankind is, not that many people have serious health conditions in a given year. So that could take a while. But the problem that I think the industry has is that the gig is up, basically. And the only way, as you said, Rebecca, and we've talked about, it's propped up by the politicians. It's propped up by their political contributions from the industry, and it's propped up by their lobbying. It's propped up by all those attack ads that we saw in Iowa during the 2020 campaign against Bernie. And that's what's propping up the system. The employers are fed up. Individuals are, basically don't have, $500 in the bank to afford an ER visit. And so this situation where individuals simply cannot get the healthcare they need is increasingly untenable. And you can see the cracks. You can see the cracks on prescription drug prices. You can see the cracks in the attitude toward the commercial insurance companies. And so I do think that what ultimately we're going to have to do is, as we've been talking about, toxify the industry, make it a third rail in politics, demand that the politicians stop taking contributions. And as one of the chat participants said, we got to be concrete about what it's going to save workers. And what's going on, I think, in part, is a politics of resentment. Some people are convinced others are getting a better deal than them. And that's the beauty of our demand for guaranteed universal health care. Everyone's secure. everyone is protected. And that sense of solidarity is created by other national healthcare systems. In the UK, in Canada, there's a sense of solidarity that there isn't here. And the healthcare system, rooted in kindness and caregiving, can actually promote an alternative ethos to society, which I think a majority of folks here are craving. And that alternative ethos has been even more the need for has been more prominent under COVID. And really, I think we ought to understand, as Dennis is saying, that talking about health opens up a broader critique of capitalism. Workers dying being killed, really, for the economy. People, corporate global capital destroying healthcare systems. This is a lens. It's the most intimate and personal aspect of public policy that affects our lives. And so it's important for us to talk about that, to use that lens and that experience to broaden our critique, but also drill down specifically on how people's health will improve. And they will get, as Dr. Rogers said, all means all. And folks in a lot of communities of color don't believe it, and we're going to have to prove it. And I think that kind of skepticism is an organizing opportunity to take it on.
And that's a significant skepticism that, I'm not sure, because, why hasn't Medicaid expansion happened in the South? And even in, Minnesota didn't do it right away, and Wisconsin, even some, northern state. But there's not this whole grant. And even if you look at labor, labor has a history of not including Black workers in the unions. So there's always been division in this country, and on different levels and in different things, this reluctance to wrap your arms around who is everybody, and does this include all Black people? And that has never happened. That's an extremely high hurdle to get over. And I'm still working on it. I have my Medicare, so I want everybody else to have Medicare for all, but I think that some people will choose to go without than give it to a group that they don't think should have anything. And that's exactly what happens in this country. And that's a bigger challenge. That's a big challenge.
I really appreciate your point, Dr. Rogers. I was recently driving through some rural areas, and you can see, it makes you wonder, like there's some big houses there, there are some brand new trucks out there, there's some big Trump signs out there, and this is the same political base. I'm not knocking on farmers or people who do that kind of work, but I think it's interesting to think about this as the same political base that this society uses to say, well, we can't have food stamps. We can't give support to public education. But we can give subsidies to farmers, which is really a subsidy to big agribusiness, to give us diabetes and obesity through corn syrup and all the rest of it. We can do that, but we can't help people who need help. And so there is a divide in this society, and we do have to do work to change that. I think that's interesting. Before Biden's election, there were a big majority of people supported a different kind of health system. Big majority, Republicans and Democrats, supported a different kind of health system. The problem is that the politicians don't, by writ large, the corporate Democrats, Republicans obviously don't want to touch with a 10-foot pole, don't want to talk about it. They've got us divided in our society. They think the problem is not Blue Cross Blue Shield, but it's an undocumented worker. They think that the problem is not Pfizer making profits through the stealing for drugs that may or may not be useful to our society. The problem is someone who's getting food stamps. And we have to do work to show that the problem is actually, we have to look up, not look sideways. That's what we have to, I think, like we've been talking about, put the fight against racism, whether it's local or against people who are non-citizens, as a part of what we're struggling for, to cut against those divisions between men and women, gays and straights, all those things. We have to come together and fight the common enemy that is oppressing us all.
Any more comments on that question? That was fantastic, by the way. Thank you. Just a couple more questions. And that leads just on this question, which Dennis mentioned and others. But given that Biden and the DNC are in the pocket of the insurance companies, what tactics can we adopt to be more militant, as Michael suggested?
I kind of like what they did in Nevada.
Yeah, I think bore from within is one definitely good option. And I think also, though, that we do have to have a somewhat less congressional focus and more movement focus. I really do believe we've got to take some of the emotional power, like, for example, we associate with Mothers Against Drunk Driving, right? The emotional power of that needs to be brought to our movement. And it's not, really becomes a movement to save lives. And we're all, the whole policy apparatus is about affordable healthcare. And that's just such a narrow frame. I often ask, what is affordable healthcare and how much does it cost? And it doesn't really bear any kind of scrutiny as a concept. It's really BS pollster crap that is totally informed how many cycles, 5, 6 cycles of Democratic congressional candidates. And here we are, the candidates who ran on Medicare for All in 2021. The swing candidates who didn't support Medicare for All generally lost. This is a material improvement in the life of workers that has profound political consequences. We're not going to win over all the racists in the Trump universe, but winning over 10 to 15%, as Senator Sanders talks about, through a real improvement in their material conditions can, I think, change some of the dynamics. And keep in mind, there are Latinx voters who are drawn to the Republican side, not just white working class voters. Black vote slightly increased for Republicans as well. We have got to address the economic realities of American workers and how they're being sacrificed for this economy, or we are not going to be able to win this demand. And the notion that we're going to win Medicare for All with the minimum wage being $7.25, or systemic racism rampant, or criminal justice reform resulting in more funding for the police instead of an actual defunding program that increases public safety, we're not going to get Medicare for All unless all of those demands are met. And we have to understand that we're the health justice wing of the broader justice movements. And that's the only way we're going to get Medicare for All, not in isolation, but as part of this broad justice uprising that demands an end to the oppression of the multiracial working class that really obviously has its origins back in 1619. And we got to get serious about that.
Thank you, Michael. Anyone else on that question? I have a few more before we wrap up. We've got a lot of questions. I'm sorry we can't get to all of them. They're really fantastic questions. I first, before I go on, Yael, is there anything that you would like to add to this discussion? I just want to give you an opportunity to say some things.
No, not really. I mean, I'm not a healthcare expert, so I'm a storyteller. But one of the things I have been thinking about, I do have a chronic illness. I have been sick for decades, and just struggled, with having health insurance. And I think what you guys were saying, like specifically Rebecca and Michael, about like how do you compel someone? And it's like, oh, well, as soon as you are sick, then this is really necessary. And just thinking how powerful the work that Rebecca, you do, and sort of the stigma around being sick. It's not really something that I talk about unless you're very close with me. You wouldn't know that. And so I'm not going out sharing my story to help push this issue forward. And so I wonder if there's some, I don't know, just sort of thinking about how to empower people who are sick to go out and do more work. There's a lot of, excellent conversation that you guys are doing around policy. But like you said, a lot of people are just moved by emotion, and how to think about all the different tactics to move people. Anyway, those are just the things that I'm thinking about as I'm really just loving this conversation. So thank you.
It's actually
go ahead.
I'm sorry. That's actually a really good question. So when I first went up to Capitol Hill and started sharing our story, I shared Charlie's story. She was 4 at the time. She turns 9 next month, but she was 4 at the time, and her birth at 26 weeks was a pre-existing condition. Without the ACA, she would be uninsurable. And at the time she had a feeding tube. So I was worried about how I was going to feed her. Around the time the ACA was won, I realized I was also able to see how things work on Capitol Hill, because I'd spent the last 6 months on Capitol Hill, and I realized what had happened to me was a policy failure. But, you know, I wasn't even 40 years old and had lost all of my teeth, and it was something I was ashamed of. I was embarrassed of, and nobody other than about 3 other people knew about it. And one of those people was my friend, Ben Wickler. I can't remember exactly how it came out, but I ended up having to tell him. And then also I told him, I want everybody covered. I want universal health care. And a few months later, I was asked to do the presser for Bernie when he introduced the Medicare for All bill. And I was talking to him and I said, okay, well, give me the talking points. By this time, I had done so many pressers for the ACA and everything. I wasn't at all worried about that. So I said, give me the talking points. What do you want me to hit? And he said, well, you know, just tell your story, but talk about your teeth. And I, oh my God, you want me to talk about my teeth? And you can see if you go back and watch the speech, I'm nervous. And there's this moment where I take a deep breath and I realize, okay, there's no turning back now. And I was terrified. But what got me through it was the purpose was greater than the fear. By telling my story, it had a greater purpose than what I was afraid of. I can help push this movement along. I can help, bring us all closer to getting universal health care. So who cares if, it's embarrassing or shameful or any of those things I was worried about, because it was more important that everybody gets coverage. And so that's actually what pushed me through it. And when I, read that speech, it was the first time I'd ever talked about my teeth. And if you look at my Facebook wall at that time, so many people were saying, I had no idea. I didn't know. But then so many other people were coming to me and telling me their stories and that they were embarrassed about. And it's funny in hindsight, it wasn't embarrassing at all after leaping off that bridge or whatever, because so many people said, me too. I'm struggling with this too. I'm so glad somebody finally said something. So my advice is, if you're struggling with whether to tell your story or whether to talk about it, go ahead, do it, because there are other people out there like you who are struggling with the same thing. And the more of us who talk about it, the quicker we can make this change and get everybody health care.
So. I really like that point you made, Rebecca, because it makes you think about the fact that people are suffering, and when corporate Democrats fail, there is a reaction to that. There is a response to that, and I think Trump was a response to that. People didn't see success; they didn't see their lives get better under Obama in many ways, and so they went and looked for the alternative. And I think there's also a danger if Biden isn't able to produce things like a Medicare for All system, that people who are suffering could look to more dangerous solutions, like we've seen with the far right trying to build and organize, because people are looking for a different kind of way forward. And I feel that's why it's important for us as socialists to put that vision out there, to say there is another way of living. We're not talking about Trump. We're not talking about this far right QAnon nonsense. We're talking about a society that's about meeting people's needs, because that does get to the heart of where people's lives are actually at, like meeting their people's needs. And that victory is going to come through a movement, through a mass movement. There's an example here in Chicago, Mercy Hospital, another hospital on the south side of Chicago that they wanted to close. It's owned by this multi-billion-dollar corporation, Trinity Health. They didn't want to provide healthcare in the south side in a black neighborhood anymore, so they packed up their bags and are moving out. But it was through a movement, unions, community organizations, PNHP. I know many rallies I've been to with Dr. Rogers and Elizabeth to fight for Mercy, because that's what it took. And now we've made some progress. Then now Mercy's been forced to sell it to another company. Now we're going to hold that company's feet to the fire to make sure they do right. I think the bottom line is that anything decent that has come about in our society, anything that's worth being proud of, came about because regular people fought for it. Slavery was ended not because people asked nicely to end slavery, it's because people fought and struggled and died to fight against slavery. Women got the right to vote, not because they asked nicely for it, because they fought and organized and marched to get the women's right to vote. Gay marriage did not happen for the same reasons. People had to fight for all those things. And that's what we have to get back to, that kind of view. If we're going to win a single payer system, a better kind of health system, it's going to be because of a massive movement that we have to build and go out there and recruit others too.
Yeah, one more thing I wanted to add is that it was very empowering to tell my story. It was very freeing. Before that, I had always hid the fact that I didn't have teeth. I refused lunch and dinner invitations just because I was embarrassed to eat in front of people. And after I told my story, the stigma seemed to be gone. And it was very freeing for me.
Yeah, I think there are many people who have the same similar stories, Rebecca. So I think that's very powerful, and you're absolutely right. I can only imagine how freeing and liberating that is. The final question, and I know we're going a little bit late, but I want to get this in this way to kind of wrap up on this fantastic discussion and answers to the Q&A. Just a question from before, which I couldn't get to, and then I'll combine it with a question that someone has asked from the Q&A. And what has been or should be the role of unions in the socialist movement for universal health care? I'm a unionized nurse, so I'm a little partial to that question, but also, what should we be doing now, someone asks. Should we be focusing on the multiple state measures or a full push for national Medicare for all? And how can DSA chapters make a difference? I know there's a lot of questions there, but if people want to respond to that in a couple minutes.
Well, I think I'll jump in. The primary author of the House bill, HR 1976, Medicare for All Act of 2021, has said publicly that she doesn't think that bill can succeed in the present House, and is not, getting co-sponsors and getting hearings are the focus, but it's not a focus to put the bill, on the floor. And instead, they're talking about a Medicare expansion. Our belief in DSA Medicare for All, and in particular in California, is that there is a state route to national single payer. And it's primarily political. We're not advocating we're going to be able to do a pure single payer system at the state level. Could try. There are some things that would have to happen federally, obviously, to make that happen. But the idea politically, we haven't had, and I would count Shumlin and Vermont as a weak case. We really haven't had executive leadership. We haven't had a governor or a president leading on this issue. And that's not a coincidence that its political viability has been reduced. So I think working on state fights like in New York and California is a political road to establishing a policy model and political momentum to win federally. And I also think that the labor movement is essential. We have unions representing a majority of workers in this country support Medicare for all. They're on record for it. What we've got to do is we've got to take the issue, which is like a third or fourth or fifth priority for a lot of these unions, and make it the top priority, as I would argue, as part of this broader justice fight. The PRO Act is essential to winning Medicare for all, for example, and memorializing the essential workers, lifting up the sacrifices they've made, and demanding that it never happen again, I think has to be central to this. And it has to be organized in the Black community, in the Latino, Latinx, Latina communities, and also the AIPI communities have been devastated by this. And it all starts, I think, with organizing essential workers, tapping into the organized labor movement, moving them into a position of making it a priority, and then building this broader multiracial working class movement, as Dennis said, because that's what it's going to take. And we haven't built it yet.
Thank you, Michael. Anyone else on this question? These questions, I should say, before we end.
Just real briefly, I think these are things that most people who are on the panel and participants in this meeting do, which is build a community, get active in whatever issue is in your workplace, your neighborhood, your school, make the connections and fight around the things you're fighting around. But I think bring in the issue of healthcare into it And that's what's going to build those connections, so that as struggle goes up and down, and if there is a peak in struggle around healthcare, people will say, oh yes, this fits in with the struggle that I'm fighting, whether it's around racism, around affordable housing, around workplace rights. It links that together to a fight that we can demand the things that we need across the board, and build the structures, build the organization of actual people, and people coming together with other people to fight for those things, and put pressure on multiple ways, whether it's through mass action, protests, strikes, those kinds of things is what's going to bring about a different kind of healthcare system in our society. Building those connections now will help that struggle in the future.
Thank you, Dennis. Anyone else? I know we've been going on for a while, so. If not, I mean, I really want to thank all the panelists. It's been, you know, a fantastic discussion, and I also want to thank everyone who was involved in bringing this event together. The filmmaker of The Big Scary S Word, Yael Bridge, our panelists, our co-sponsors, you, our audience and discussants, and who will be receiving follow-up emails about this and upcoming events. Thank you for all the great questions and comments. We couldn't get to all of them, and I'm sorry about that, apologize. But there's many more discussions that we will be having in the future about this topic and many more. So thanks to everyone who can't see, who's been working behind the scenes. I just want to give a shout out to them, to Sunshine Royayan Lutter, Michael Bennett, David Duhalde, and Priscilla, I'm sorry about saying the names, Verano from the Democratic Socialists of America Fund, and Flynn Murray and Lyra Walsh Fuchs from Dissent Magazine. The panelists tonight have given us a lot to think about and some direct actions that we can take to fight for universal health care. The follow-up email to this event will include a link to the video that will be housed on the Democratic Socialists of America Fund's YouTube channel. Please like the channel, share the video widely, and get involved in some of the opportunities for action provided by DSA's Medicare for All Committee, Physicians for National